Okay, let me know when everyone's ready. Everyone's right? Okay, good morning Queensland and good morning Mackay. It's wonderful to be with you here this morning, and of course I'm joined with the Treasurer, the Chief Health Officer, the Mayor and Julianne Gilbert, the local member. And it's wonderful to be here, and it's great to see people coming in their cars to get vaccinated here at the showgrounds. And if you're living in Mackay and you haven't been vaccinated, it's time to get vaccinated. This region, I know, can step up, especially during times of natural disasters, and they can do it again. So today is a good day to come out and get vaccinated. Queensland, we have 10 days to go. The countdown is on, and we really need you to get vaccinated. In terms of let me give you the COVID update first, and then we'll talk about our announcement where we're having a Super Saturday across the state where people can go into their schools to get vaccinated. But I want to talk to you just briefly about our COVID update. So we have 5 new cases, 4 are overseas acquired, and we do have 1 new case, a community case, in the Gold Coast. Now, this is a wake-up call for the Gold Coast. Dr. Young will give some further details. Now, the issue about this gentleman is that they were not vaccinated. They were potentially infectious in the community for up to 10 days, and we're having further investigations, but it is believed that he is from interstate. But Dr. Young will give some further details about that person. We've had 7,616 tests in the past 24 hours. So Gold Coast residents, if you have any concerns or any symptoms, please go and get tested. And we also need people on the Gold Coast to go and get vaccinated, because we have 156,000 people on the Gold Coast at the moment, 16 plus and over, who are currently not vaccinated. And we are a little bit concerned about this person that has been infectious in the community, and if you have any symptoms whatsoever, now is the time to get vaccinated. Good news, 16,407 vaccines were administered by Queensland Health yesterday. A big thank you to all of our workers out there. You are doing a mighty job, and thank you to the community for encouraging everyone else to come and get vaccinated as well. So now we're up to 73.21% of eligible Queenslanders have had their first dose, and 58.07% are fully vaccinated. But come on Queensland, we've got to do much better. We've got to lift these vaccination rates, and I'm absolutely concerned about regional Queensland. So in Mackay, this showgrounds here can do up to 500 doses a day on average, but it can actually ramp up to 900. And yesterday, over 550 people came and got vaccinated. So that's fantastic news, but there's a lot more capacity here, so we need more people coming in. Mackay's vaccination rate is 66.4% first dose and 49.5% both doses, so we need to lift this. But I am concerned about some of the region's vaccination rates. For example, Bowen, 48.4% have had their first dose. We really need to lift that, Bowen. So if you are living in Bowen and you're unvaccinated, this weekend is a great time to go and get vaccinated. Dysart, 34.7% first dose. Moranbah, 46.5%. I just had some news that there's going to be some extended hours in Moranbah, extended times in the evenings to allow more people to get vaccinated in Moranbah. Proserpine, 67.2%. Serena, 61%. Whitsunday, 63%. Now we know Mackay and Proserpine and the Whitsundays are absolutely gateways for tourism, and we know that on the 17th of December there will be tourists coming here from all around Australia, so please go and get vaccinated. Yesterday I was in Townsville, and in some good news we were concerned about Charters Towers. Well, our vaccine coordinator, the Deputy Commissioner, advised me that this Saturday 800 people are booked in from Charters Towers to get their vaccine. Now if Charters Towers can do that, there's no excuse for any other regional community across Queensland not to come out and get vaccinated. And today I wanted to announce some good news about our Super Saturday vaccination blitz. This is fantastic. This is education and health working together to identify 100 schools across Queensland that will be open from 8 till 2 this Saturday. So if you have a student at the school, or if you are unvaccinated yourself, make it a family day out. Make sure that the parents come, the grandparents come, you can walk in and get vaccinated. Now, around the whole Mackay region, we've got Serena State High School will be open, Pioneer State High School, Proserpine State High School, and Mackay North State High School. So it's absolutely critical that people come out and get vaccinated. So there's a whole list, and I might just read out the list for the Gold Coast because we are concerned about that infectious person on the Gold Coast. So if you're living on the Gold Coast and you're one of the 156,000 people who are not vaccinated, you can go this Saturday to Pimpama State Secondary College, Upper Coomera State College, Southport State High School, Palm Beach Currumbin State High School, Coombinbar State High School, Nerang State High School, Varsity College, Miami State High School, Eleanor State High School, or Helensvale State High School. We need people to be vaccinated. If you are unvaccinated, you are more than likely ending up very, very sick from COVID or in hospital or an ICU. I don't want to see that happen to residents across Queensland. So Queensland, come on, get vaccinated and come out and support our Super Saturday vaccination blitz. I'll hand over to Dr. Young to give an update about the Gold Coast case, but also to once again encourage families in this region to please come and get vaccinated.
Yes, so we have one new community-acquired case in the Gold Coast. This is a gentleman in his 30s. He lives in a resort apartment complex in Broadbeach, and we understand that he was in Melbourne on the 10th of October. We're getting all of that clarified at the moment, but that's our understanding. He then came back into Queensland. He is so sick. This is a man in his 30s. He is so sick that we're having difficulties talking to him and getting information from him. So he started to develop symptoms on the 11th of October, which means his infectious period goes back to the 9th of October, but we believe he was in Melbourne at that stage. Then developed symptoms on the 11th of October and became increasingly unwell. Presented to the emergency department at Robina Hospital yesterday, where they tested him, came back positive on 2 separate tests, so he then was transferred later that evening to the Gold Coast University Hospital, where he is now. He lives by himself. He works as an Uber driver, so we're working very closely with Uber, who've been excellent this morning, to get information about whether he's had any drives during the time that he was infectious. So whether anyone in that Broadbeach Gold Coast area caught an Uber that he was driving during his infectious period. We don't have venues at this stage because, as I said, he is so sick that he's having difficulty communicating with us and difficulty remembering, as you can imagine. So this is very difficult for him, but it is also very difficult for the Gold Coast community because I can't give you those areas that he's been. So that means anyone who's been in that Broadbeach area or any of that Gold Coast area since the 11th of October, when we believe he may have been back in Queensland, any symptoms at all, today's the day you really need to come out and get tested. And please don't wait like this poor gentleman has, that he's so breathless he can hardly talk to us. Come forward straight away, any symptoms, so that we can get you tested. Then also, I need people in the Gold Coast to wear masks. No different to I've been asking now for several months, but I know that compliance has not always been great down on the Gold Coast. This is the time to make sure you're wearing masks whenever you're indoors or in a taxi or an Uber ride share. Very, very important. And then I need you to use the QR check-in. This gentleman hasn't used his since the 18th of September. So it is very hard to work out where he has been in the community. So it's really important, please use the QR check-in wherever you go and wherever you might be in Queensland, because this could happen anywhere in Queensland. And then the last and the most important is to get vaccinated. So there are 156,000 people in the Gold Coast. I know it's a big population, but that's a lot of people who haven't been vaccinated, 16 plus, and another 20,000 kids, 12 to 15, who haven't yet been vaccinated. Please, there is plenty of capacity in the Gold Coast to vaccinate, as there is across our entire state. And that is the most important thing that every single person needs to do. Gold Coast, you don't have 10 days. You need to do it immediately. The rest of the state, we've got a 10-day window to get everyone vaccinated, because then you'll be fully protected when we open up our borders in December. So this is so important. Please, there is so many places you can get vaccinated, and it is free. No matter which vaccine clinic you turn up to, whether it be a pharmacy, a GP or one of the Queensland Health vaccine clinics, just walk in. You don't need an appointment. If you want to organise your time so you know that you can come in with the minimum wait, of course, make an appointment. I encourage that, and definitely with GPs. But for other places, just walk in whenever suits you and get vaccinated. Thank you.
Well, great to be back in Mackay with the Premier and the Mayor and our colleague Julianne Gilbert and the Chief Health Officer. And as I keep saying time and time again, one of the lessons that COVID has taught us, if you get the health response right, you get the economic recovery, you get the economic dividend. We've seen that across the length and breadth of Queensland, with unemployment now dropping to the lowest it's been since 2009 for 12 years. We've seen it here in Mackay, and hasn't Mackay been an absolute standout when it comes to our economic recovery? Unemployment in August in Mackay was 3.6%, which was a phenomenal result, and just shows you when you stay safe, you can keep your job and you can keep the economy going. And that's why we need people to get vaccinated. Dwelling approvals in Mackay almost 90% higher the year August last year to August this year. Consumer spending's up. It's in fact up 30% higher than it was before the pandemic started. So not only have we recovered everything we've lost, we've got consumers spending. But we need people to be safe. Whether you work in mining, agriculture, in the sugar industry, in the great mining support services industry here, whether it be engineering, technical services, everybody works to keep each other safe, and that's what we have to do. We have to keep each other safe. Because when Delta comes, and Delta is coming to Queensland, we won't be crushing it again. Delta will be here to stay. It is very dangerous, and we need to have all of Queensland, but particularly regional Queenslanders, vaccinated and prepared for its arrival. And of course what we need is everyone in Queensland to be supporting the vaccine. Individuals, families, businesses and communities. And we need every politician in this state to support vaccination. And one of the real and genuine threats to Queensland at the moment are politicians who do not support vaccination, who are undermining our vaccination campaign. Up here in the north, locally, we've got the anti-vax nonsense of people like George Christensen, and down south we've got people like David Crisafulli, the leader of the LNP, who time and time again refuses to support the mandatory vaccination of health workers. He was asked that again today, and he refused to answer. In fact, when he was asked about whether he supported vaccines, he said, do your own research. Well, David Crisafulli, you don't have to do your research. You don't have to look at Google. Go to your GP, and your GP will tell you to get a vaccination. That is so critical. And this is not a decision of government. This was a decision of the Australian Health Protection Principal Committee. That's all the chief health officers and all the chief medical officers who got together and said, health workers need to be vaccinated and we need to mandate it. If people like David Crisafulli had his way, we would have nurses in hospitals unvaccinated treating people. We would have COVID being spread in hospitals because we didn't have health workers vaccinated. This is simply an unacceptable position for a leader to take in this state. When we are introducing the virus will come to Queensland. We need people to be protected. So there is a very simple question for David Crisafulli that needs a very simple answer, yes or no. Do you support the mandatory vaccination of health workers as recommended by the AHPPC? Yes or no?
Good morning, and isn't it great to have the Premier here in Mackay with the Treasurer and Dr Jeanette Young again. This shows how important Mackay is to our government. everybody in our government cares about everyone across our region. So make sure that you get out there and you get your vaccination. We are opening up the borders because that's what people have asked us to do. They have been ringing my office saying, let's learn to live with it. The only way that you can live with COVID is to be vaccinated. So don't be the one on Christmas Day to give your family COVID. That is not a gift that you want to give to anyone. Our borders will be open, your family can come and visit, so make sure that you keep your family safe, keep yourself safe. Don't be like that poor gentleman down on the Gold Coast that we heard about this morning, and make sure that you give your family gifts that they can unwrap and not have to go to hospital for. So get out there, get jabbed, get out to the schools. The schools that are on the list here in Mackay, everybody knows how to use those schools. They're very big schools, and they're also going to have their Vax Hub set up in the same place where you go to vote. So if you live in those neighbourhoods, a Pioneer, which is one of our really large polling booths, and also North High, a lot of people walk down there. So if you're used to walking down to go and cast your vote, walk down and get a jab. It's just really easy. Just walk straight in and take the rest of the family with you. So this time everybody can go in and get their vaccination, kids from 12 up. So get down to your local schools, because our schools in Mackay are great schools and you'll want to visit them. Thank you.
Well, thank you and good morning. Generally when the Premier and Treasurer come to town, they bring money. But this is a great message that's probably even more important than putting money on the table. The message about COVID and the importance of, particularly for our community, to get those COVID vaccination rates up is extremely important. When the Chief Health Officer was in town a couple of weeks ago, we had some very strong messaging, and I've got to say that worked. Last week was our biggest week ever in terms of vaccination. 10,600 and almost 70 people moved through our vaccination centres across the region. I've got to say that this week we are doing even better. So, Premier, your figures at 66% for us. We've always been about 10 or 11% behind the state average. We've knocked 5% off that right now, and we're catching up. So I'm quite confident that Mackay's stepped up to the plate. We've got a lot more to do, of course. You've heard when the opening date for Queensland is, and as has already been said, we don't want to be the people turning up at our Mackay Hospitals and Health Services facilities saying, help me, I've got COVID. So the answer is, get the vaccinations. And probably from the correspondence that's come across my desk, there's a lot of people who are genuinely still scared about getting a vaccination. And all we can say to that, there's now 90,000 Mackay region residents actually have at least one jab in their arm. And we're still upright, we're still going to work every day, we're still producing this for this powerful economic region of Australia. So the answer is, you just got to get vaccinated. There's ample opportunity to do it right now. This weekend, another super weekend, so I'm expecting we're going to see a huge increase in the vaccination figures, because Mackay people residents are really realising that the opening date is just about on us. We don't need to be one of those people who are not vaccinated for whatever reason it is by the time December 17 rolls around.
Thanks, Mayor. And can I just back in what the Mayor said too? Look, if anyone does have any concerns, look, please talk to your GP or your pharmacist. And if you come into a vaccination centre, oh my goodness, the most beautiful staff are working here, and they're more than happy to greet you with a lovely smile, sit you down and talk through any concerns you have. And it's so simple and easy, and can I assure you, it does not hurt at all. So please come out and get vaccinated. So we're happy to take a few questions.
Are you concerned that single-dose vaccine rates are so low?
It's rising, so that's good to see that's rising, but I do want more people to come and get vaccinated.
The vaccination rates overall, so they are going down a little bit. Are you concerned by that?
Well, today's numbers have actually increased, so that's good to see the trend is coming back up, and we're hoping for a really big turnout on Super Saturday. Look, we're trying to take the vaccine to people. Look, down here out the front of the showgrounds, there's a mobile van that's going around to smaller industries and communities to make sure that we can take that vaccine. But another really easy way to get vaccinated is to go to your GP or go to your pharmacist. I mean, the Commonwealth's done a great job in expanding the numbers of doctors that are administering the vaccine. So please, there's a lot of avenues out there. So really, there's going to be no excuse in 10 days' time because everyone knows they've had the opportunity to get a vaccine.
The general trend is a bit down. Is a little bit down.
We'd like to see it. Of course, we'd like to see it higher. We need to see the trend increase dramatically.
And do you think that's
age group being
Sorry?
with the concerning age group being 16 to 34-year-olds at
Yes.
the moment, you are pushing schools throughout the region. Why not focus on unis and TAFEs as well?
Yeah, I have spoken to some of the Vice-Chancellors and they have been driving that in their local universities. But of course, we are looking at all avenues to get the vaccine out to young people as well. We're hoping with the schools, that's a great incentive for young people to come in and get vaccinated and to make it a family day out.
Given that trend, are you concerned about obviously the message you've been trying really hard this week to get the message out there? Are you concerned it's not working?
Oh, I have had ministers out and about across Queensland. You only have to look at, there's 800 people in Charters Towers that are going to get vaccinated on Saturday. I think that speaks volumes. This was probably a group that may not have got vaccinated. So we want every single person out there to get vaccinated because it'll protect you, it'll protect your family and it'll protect your community.
Once borders reopen, will unvaccinated people be allowed in state government venues?
We're working through those issues, but I think what you'll find is a lot of businesses will take action and government will look at those issues as well.
And what do you recommend local government areas do about like public pools and places like
Well, you
that?
can speak to the Mayor about that, but I think councils will make their decisions as well. I mean, it is really critical for people to get vaccinated.
Just on the Gold Coast case,
Yes.
is there any thought to a localised lockdown at all? Is there
No.
any-
No, because the vaccination rates there are quite good, but we need to see more. So, like, if anyone has any symptoms on the Gold Coast, it is absolutely critical that you go and get tested. This man, like Dr. Young said, it is very hard to get information from him. You don't want to end up like this young man in hospital, extremely ill. He's a young man in his 30s. So he's in that age group that we really are stressing to get vaccinated. So please, everyone, go and get vaccinated. And if you're on the Gold Coast, today is a good day to go and get vaccinated if you haven't.
How did he get in? How did he cross the border?
There's going to be investigations into that, yeah.
So did he have a border pass? Was he in home quarantine?
The police will be looking at that. As you can appreciate, he's very sick at the moment. It's very hard to get information. They've worked with him overnight into the early hours of this morning, and we are giving people the most up-to-date information that we can get from this man. Do not be this young man ending up in hospital, not being able to communicate well because you are very, very sick with COVID.
He obviously wasn't in hotel or home quarantine, was he?
No, not to my understanding, no.
And what date did he cross the border? Sorry, just to clarify.
We'll have to get that. We don't have that information
Not
yet.
sure. Do police know what date he crossed the border? Or is that still...
No, they're still trying to get that information.
Given that hospitals are already at capacity past that December reopening date, if people get sick, should they go to an emergency department or to a GP?
If people are critically ill, they will make their own decisions about their health, but the emergency departments are there to cater for people who are extremely sick. So the way you stop getting extremely sick from COVID is to get vaccinated. I mean, I cannot be any clearer. I think the people of Queensland know me and they know Dr. Young. I mean, we cannot be clearer on this. It is absolutely critical that you get vaccinated so you do not end up in intensive care.
Premier, with only 10 days left for Queenslanders to get vaccinated, when will you be releasing the second roadmap? And wouldn't it be better to release it now?
No, there's
rather
no
than 2
second
weeks?
roadmap. So I've made this very clear over the last few days that what people are doing, businesses will make up their own minds.
So there will be no support for those businesses who choose to ban unvaccinated people from their business?
Look, go and have a look what's happening in Victoria and New South Wales. They are making these decisions. The businesses are making their decisions to only allow vaccinated people into their venues. And if you're a young person and you like going out, you may face the prospect of a nightclub or a bar saying only vaccinated people can come in.
The young man in hospital, is he on oxygen or is he intubated?
My understanding is he's getting oxygen. Yeah.
Premier, in regards
Yeah.
to the review that's currently being undertaken at Mackay Hospital, are you alarmed by the at least 55 calls that have come through to the dedicated feedback line?
I think it's great to see that people are coming forward. I think that's excellent. That's why they have set that up, and the results of that review will go from the hospital board to the health minister.
And now that there's a review, would you call it a health crisis in Mackay at the moment?
No, but I am concerned, and yes, I'd like to see the results of when that review was completed.
It's been revealed that
Okay, one at a time.
Are you considering bolstering ICU capacity in some regions or flying specialists in if the need arises?
Guess what? We won't need to do that, folks, if everyone gets vaccinated. So please go and get vaccinated. Everyone can see what has happened in New South Wales and Victoria with massive outbreaks, with thousands of people getting COVID and hundreds ending up in ICU. And tragically, people are dying from COVID. This is a world pandemic. We need everyone to get vaccinated. And the higher our rates of vaccination, we're protecting all Queenslanders by getting vaccinated.
I mean, next week there's legislation due to be introduced about shield laws. Is there going to be a...
No, there's not.
That's what we've been told.
Well,
there has been.
that's not correct.
Okay, well, in any case, is there going to be protections for the for journalists to stop them having to reveal their confidential sources to the Triple C?
There is no legislation going in next week.
No legislation?
No.
It's been revealed that $40 million has been spent on overtime for paramedics. Why are paramedics so understaffed in Queensland?
Sorry, say that question again.
Why are paramedics so understaffed in Queensland? It's been revealed that
We've increased the number of paramedics since we've come to office. I'll get those details
Just
for
back on
you.
the shield laws, Premier, do you support protecting journalists
Yes.
from having to reveal their sources to the Triple C?
I will look at the legislation when it comes to Cabinet, and Cabinet will make its
And
decision.
when, obviously, the government made a commitment for this
Yes.
year, is it going to happen this year?
As I said this year, yes, it will happen this year.
Do you
George
believe there are...
Christensen has said
Last
that
one.
he will lead a protest if you lock down areas like Mackay. Is that dangerous for him to be making comments like that?
George Christensen is putting lives of people here in Mackay and surrounding areas at risk by making reckless comments. I have the Chief Health Officer here. It is absolutely critical for the protection of your health to go and get vaccinated. We do not need reckless comments by politicians that are putting a community's life at risk.
He's posted on Facebook, he's threatening to sue you. What's your response?
About what?
They're calling him anti-vax. He says he's not an anti-vaxxer.
But he's telling people not to get vaccinated. He's
Do you
going to have
think the
protests.
NRL Dolphins Club should add Redcliffe back into its name or go with...
That's a matter for them.
All right, thanks everyone.
All right? It's good to have a Redcliffe question here in Mackay, isn't it?
Treasurer, can we just get you on one question, please?
Yeah, sure. Thanks, everyone.